and welcome back to the studios of the National Television Network, the Government Information Service, NTNGIS. I'm Lisa Joseph with my colleague, Primus Hutchinson. We're back with our live coverage on the national response to COVID-19, the coronavirus. We're in the home stretch of our live coverage for today, and just to let you know that this will be happening every day. You can tune in live to NTNGIS for the latest information on the national response to COVID-19. In this hour, we're joined by the president of the St. Lucia Medical and Dental Association. She's Dr. Merle Clarke. And before we get to her, just want to go through a statement that was released last evening by the association, and that will be the sort of crux of our discussion here this afternoon. That statement read, in keeping with international guidelines and the need for social distancing, one of the key pillars of prevention in the management of COVID-19 pandemic, the St. Lucia Medical and Dental Association strongly recommends that all members, physicians, and dentists, for a period of at least 2 weeks, refrain from providing care to patients within their office spaces and instead utilize the various forms of telecommunication which are widely available for urgent consultations. This course of action is being taken primarily to protect our patients and by extension our community, and to ensure that urgent healthcare needs are addressed while there's seemingly while these seemingly extreme but absolutely necessary measures are implemented. Dr. Merle Clarke, thank you so much for joining us. I know it has been a busy day for you.
It has been.
Let's unpack this statement,
Yes.
because I know that it has generated so much discussion. Foremost on the minds of the public would be, are doctors now abandoning their patients and because they are running scared themselves?
Absolutely not. We need to dispel that off the bat. We have received feedback that the press release might have seemed insensitive at a time like this, when everybody's looking to us physicians for guidance, in a sense, along with the Ministry of Health. It does seem that way. That is how it was perceived, and that has caused quite a bit of consternation. But I want to assure St. Lucians that that is not the case. We took an oath. Every single physician takes an oath to do no harm, and we adhere to that oath at all costs. Even sometimes at the risk of harm to ourselves, we adhere to that. We are never going to abandon the St. Lucian public. This is not what this is about. It's about their protection. What do I mean by that? The rationale for the press release. And of course, the ministry has had guidelines for certain things, but there had been a shortfall in part with reference to guidelines for the private sector. The focus has been predominantly on the public sector, where of course most of the patients, the suspect cases of COVID would probably go. It is not unheard of, however, and this happened in H1N1 as well, that a patient would get to a private physician. So that, in a sense, was more for private practice, certainly not so much for public practice. And we'll explain what the implications of that potentially could be. So what we are saying, we're not asking physicians to necessarily shut down their offices at all. What we are saying, when we look at the short history we have of COVID, the patients who are most at risk, our elderly patients, patients with underlying chronic diseases, lung diseases, diabetes, hypertension, cancer, that sort of thing. We want, during this period, for the most part, to keep them out of the offices. We want, for the most part, to keep them out of hospitals right now, in as much as we can. That does not mean we are not going to provide care. What we are saying, in every crisis, there's opportunity. So we want to look at the option of doing more telemedicine, because to a certain extent, we do it right now. So a patient may call in, say a patient who may be bedridden, a relative would call in, the labs were done, what are the results, what do you guide, what do I do, where do I get the prescription? So we have written to all our partners, the pharmacists, the labs, the radiology centers, that if we see a patient, and that could, like I said, we've been doing certain telemedicine to a certain extent, and there are different apps that could be used, because of course you have to think of the question of security, patient information, and that sort of thing. There are secure apps that we can use to do it and have a consult. Of course, that's a stable patient that you know, with a patient from home. In my case, I'm a kidney specialist, so my patients definitely would be at high risk for adverse outcomes if they were to contract coronavirus. So we definitely want to keep a patient with kidney disease who does not require dialysis away from the office for the most part. If a patient needs to come in, there's no saying that we won't tell them to come in. What we do not want is to have multiple patients in a small office space or milling around the hospital. So it's a question of reducing traffic, and as we said, the social distancing of sorts, which is a key pillar in this fight. That is what we want to encourage and protect those most vulnerable patients among us.
Now, how does the public begin to even wrap its mind around it? Because we are in a culture where we are very much accustomed to going into the doctor's office, you sitting down, and then to have the doctor prod you and ask you questions and look at the mouth and so forth. So how now can you encourage the public to not feel as if they're not getting the best of care, and that the doctor isn't paying attention, and that the doctor may not know what he or she is really going to be looking for diagnosing?
It is not business as usual, and I think we all understand that. So we are not saying a patient, for example, who calls in, I have abdominal pain, that patient, that is not the kind of consult you're going to do with you. You could do the teleconsult, but that patient probably is going to have to come in so you could examine. The patient who we are talking about is probably an elderly patient over 60, and let's keep in mind that the mortality rate over 80 is 15%. As you age, the mortality rate with COVID goes up. So that is one of those older patients. Of course, those are the same patients who probably aren't so au courant with technology, but of course we have to involve the family. Family has to come in there so somebody could assist. So I would have seen that patient probably 3 or 4 months ago anyway. So it's time for your appointment. You call as usual. Your appointment is made, or we call you if your appointment is coming up. Then we explain to you, because some patients you still have respiratory symptoms, because we want to be guiding patients accordingly, and we have made it clear to the chief medical officer that we are there to assist in that regard. Private practitioners, everybody, this is one nation and we're going to fight this thing together. So we know there are respiratory centers which have been opened, and we are assisting guiding patients to the respiratory centers if they do have symptoms. But our regular patients, the patients who may have heart failure, who may have diabetes, that patient who I know very well, who is not complaining of anything new, who I just need to see their blood sugars, their blood pressures, that sort of thing, review that, ask them if they're feeling anything different. I don't necessarily need to do a full physical exam for that person. And of course, that assessment is made on a case-by-case basis. And that patient, then if we feel I've looked at everything, I'm fine with that, then we call in the prescription, or we prepare the prescription, scan and email that to the pharmacist, and we've spoken to them in that regard, just to reduce the traffic and the risk to those patients. Because to get to the office, they'd probably have to get on a bus, sometimes 2 buses, be around town, and we want them to stay home for the most part.
Yeah, because I wanted to get to that about, people that would need a sort of refilling of the prescription. So we'll talk a little bit more about that. We'll take our first break and we'll be back with the conversation.
It's never going to work for everybody.
No.
Personal risk reduction is important. Germs are everywhere, and you can reduce your risk of infection by practicing some basic infection control measures. Taking the stairs, avoid touching the railing. If taking the elevator, ensure you use hand sanitizer immediately after exiting the elevator. Hand sanitizers with 60% or more alcohol are great to use, so have some readily available on your desk for quick use. Have your own personal bottle to carry with you when away from running water and soap. Germs can spread easily and be anywhere. Be sure to wipe down or disinfect desks, telephones, and keyboards. Washing your hands often will reduce the spread of germs, but you must wash them as recommended. Masks and gloves serve a purpose and provide protection when used in the recommended settings and when used correctly. They are not practical for the office or business place and can lead to the further spread of germs when used badly. Use only if you are coughing and or sneezing or taking care of someone who is ill with flu-like symptoms. For more information, call the Ministry of Health and Wellness at 468-5347, 468-5349, or 468-5350.
And welcome back to our discussion live with Dr. Merle Clarke, who is the president of the St. Lucia Medical and Dental Association. Just before we went to break, we were discussing about the prescription.
Yes.
And you indicated that there is that sort of system in place, not an unusual practice for doctors to scan and email and speak directly to the pharmacies in order for a person to just go and pick up their prescriptions.
In fact, in the public sector, it's all electronic. So it's printed out and the patient could use that same prescription. And of course, with patients with chronic diseases, normally we'd have repeats on the prescription. So you don't have to come in every month for that. So what we're essentially telling the patients, we don't, if you do not need to come in, we will call in the prescription or write the prescription, send to the pharmacist, and you could pick up the medication there. So that essentially reduces your risk of exposure, not only to potentially to COVID-19, but to other infectious diseases.
Now, doctors are not suspending walk-ins.
Now, there is where the catch-20 is in the part. We would prefer patients to make appointments because a form of triage is done there, because you could ask the patient there when you call for an appointment, do you have a travel history? Have you had fever, respiratory symptoms? So for now, actually is more of a time when, if anything, they probably would be looking to suspending walk-ins. But if you have an emergency, you have abdominal pain, whatever it is, just call the physician that you would normally call. Nothing of that changes. Just call the physician and you would be guided as to what to do. Our aim is simply to reduce large numbers of patients in small clustered waiting rooms. That is all this is about.
Okay, let's break from the English and let's just say hello to Primus, because we want to be able to not overwhelm the conversation too much. Primus will take over and have a little chat there in Creole.
Ok, merci Lucia, monsieur madame, Colissa de session après-midi, c'est pour discuter qualité, façon qui association docteur et les monde médical, les personnels médical manière pour adresser la situation COVID-19 avec Corona, quelle décision il prend à cette situation, ça avec nous, Dr. Merle Clarke, qui m'était supposé connaître assez bien même. Dr. Clarke, merci à toi. Expliquez-moi, parce que c'est une situation qui moi-même aussi t'es distrait, les informations m'ont sorti. Expliquez-moi au public là qui directement est nécessaire pour faire ça. Pour quelle raison c'est mon pas ça qu'on avant visiter ce docteur en bureau.
All right. So premièrement, nous pas avec personne panique. Nous pas qu'à abandonner cette licence, nous pas qu'à jamais faire ça, nous pas ça faire ça, nous ça perdre licence nous si nous fait ça. So ça nous qu'à try faire c'est protéger c'est juste cette licence qui plie ça nous a ouais, là nous garder China et Italie et côté ça qui est shy casse Covid, c'est mon qui pas qu'à faire bien, c'est mon qui can briser aller ICU, c'est mon qui a briser rester l'hôpital pour long terme, c'est mon qui ça mort, c'est mon qui ni plus nous pas dit jeune monde pas ça, il pas arrivé jeune monde, mais plus monde qui est plus 60 et qui ni disease ko sick et pressure et be cancer et be qui hani problème et puis lungs yo, c'est mon nous briser protéger plus against COVID. So, nous pas qu'à dire ces office là qui est fermé complètement, ça pas qu'à fait. Ça nous qu'a dit là on est crisis là toujours ni opportunities pour faire plus un bagage ou peut-être te pour qu'à faire plus. Ou attend cette liste pour que ça docteur me passe just couiller moi avec labs moi là yo joindre. So c'est opportunity à chom nous peut-être qu'à faire ça plus. actuellement nous ni différentes manières pour parler by moun. FaceTime, WhatsApp, là ni tibre différentes manières, là ni apps yo ka fait by docteur même pour parler avec patients yo. Et ça ka fait tout payer la terre. Pas cette liste tout seul. So ça nous veut c'est pour ces patients ça là rester la caillou. Puisque même si on a symptômes COVID, nous still voulons rester la caillou et couiller nous et nous caillou qui ça pour faire. Because là ni côté où ça allait, par exemple, ministre cette polyclinique là, polyclinique Denry, l'hôpital Denry, et yo kay hen 3 lot comme moun qui ni ces symptômes ça sous cabri vite ou sous ni la fièvre sous just sortir côté koyoni COVID, qu'on nous caillou aller là avant. So really pas qu'à sortir bien. So c'est qualité ba ça nous voulons faire. So mais l'année à de moun yo peut-être pas qu'à même savent yo malade et yo kay là. Yo ça là et yo si yo infecté yon ces patients ça peut-être pas qu'à faire bien. So nous actuellement ko tout ça qu'a passé, nous versons moun ça rester la caillou. Go maman ou go papa ou go auntie rester la caillou pour actuellement nous kay try point que ça nous appelle Telemedicine. So, et vous pas ni pour worry la prescription ou comment y a une prescription ou docteur a une labs ou depuis faire ces blood tests là, y a email. C'est lab là ka email ça ben actuellement, so nous ka joindre ça. Ou faire ultrasound, y a envoyer ben nous. Prescription là, nous ça voyer by pharmacie et ben nous ça couiller pharmacie et dio, moi ka matcher prescription ça by moun ça là. C'est pharmacie ni toute signature, toutes ces docteurs cette liste et qu'on est pour mettre stamp. So la pani chasse moun ka fait fraud. Comment y a dit ça? Un whole system ça. So tout ça nous ka fait. Moi ça press release là, peut-être à moun di il pas c'est nous ka abandonner cette liste mais c'est pas sa pièce. C'est pas sa pièce nous ka try protéger c'est cette liste. Et quand l'autre bagage qui est important, ça nous veut faire c'est pas expose tout docteur cette liste. Parce que si tout docteur malade, nous n'y a un problème. Et ou pas même ni pour malade parce que si ou expose, on est pour quarantine. So nous n'est pour assurer l'année assez docteur que si yon docteur because nous savons la kayni a des docteurs qui kay briser quarantine là ni l'autre docteur pour replacer yo puisque right now la pani pièce pays qui ça hendo manière yo te ka hendo avant Cuba pas savoir tout ça vle Taiwan pas savoir tout ça vle même si yo ça hende pas ko yo te ka faire les tout pays là ça c'est pandémique ni problème là. So c'est pour ça nous ka try protéger ces moun ça là. Et nous dit ça nous on work qui ça ka fait l'autre 2 semaines là. Et après ça, nous avons assess pour si nous avons ouvert completely ou si nous pour continuer de dire c'est un moment rester la caillou because ça nous avons ça qui a fait China et Italie c'est mon qui n'est plus payé 80 l'année yo 15% kamos yo hen maladie ça là so c'est ça nous avons try prevent.
Moi juste actually si un cas en accident associé par comme ça mon blessé l'autre bagaille comme ça soit bail si vite yoni pour la ni ambulance pour aller docteur pour autres catcher les situations ça là
oui mais c'est mon ça kay public sector because on y accident kay l'hôpital là pas emergency pas under ça là nous pas parler about ça c'est seulement pour moun qui nous connaît so moun nous ka ouais office ou peut-être l'année ou ka ouais c'est moun ça ou connaît c'est moun ça que peut-être ou il y a 3 mois qui passaient et en emergency toujours quand il y a emergency
une situation dans un mauvais mal dans attaquer
right so même bagaille là so ça nous cas dentiste là si c'est un cleaning pour actuellement ou ça fait cleaning ou 2 semaines ça fait cleaning ou 2 mois mais si ça mal dans mon n'a besoin d'y way because l'autre problème nous ni ça nous cas que PPE protective equipment ou caméra là ni mais nous savons whole later à la shortage. So nous pas vle fini so là nous parler avec mon central procurement là ça yo veut faire yo ka prioritize yo ka buy priority l'hôpital là access center ko ka west mon qui peut-être ni COVID-19 so yo passe by tout monde tout PPE yo vle so c'est pour ça also nous veut docteur nous protéger ko yo because ou pas ka hen tout PPE dentiste là amphijay mon so ou ça hen infectious mon nani so c'est pour ça nous ka pour cette mesure ça pour try pour si moun pa kay hen virus ça because il ka transmettre bien vite.
Docteur c'est un bon bagage ou venir ici pour expliquer puisque moun qui te film qui te marcher
non. Et moi comprendre because les moun commence dire yo ouais ça ka sam docteur ka aborder les moun nous ouais nous tenir pour venir parler because c'est pas ça nous ka fait pièce.
OK. Ah ben monsieur madame nous ka causer puis docteur Merle Clarke, qui est président de l'association pour les professionnels en affaires médicales, docteurs, affaires comme ça. Nous allons prendre une petite pause et que nous vivons Lucia qui continue la conversation avec docteur Clarke.
Mr. Merle, you asked me about the health.
With soap and lots of water. Get between fingers. Get under the nails. Go above the wrists. Do this for no less than 15 seconds. Rinse properly. Dry with a clean towel. If there is no water, do the same washing motions with an alcohol-based hand sanitizer containing at least 70% alcohol.
Wash your hands. Wash them right. This message brought to you courtesy the Bureau of Health Education of the Ministry of Health and Wellness.
And we're back in studio with Dr. Merle Clarke. We have some questions coming through on Facebook. And yes, you're watching, you have questions for the doctor. You can feel free to send it in on our Facebook page there. Somebody wants to know, what about pregnant women? How vulnerable are they amidst COVID-19? And if they were to be perhaps any complications with the pregnancy, what do they do?
So we are early in this pandemic, so there's a lot that we do not know. And it's not yet known if there really is any effect on pregnant women. What is being seen, the babies are being born fine. There doesn't seem to be, but this is only with 3 months into this pandemic. So the babies being born now would have already been quite mature anyway. So it would be left to be seen what happens. But even with the closure of offices, with how it was misinterpreted, and perhaps we should accept the fault in how we wrote it, and sensitivity needs to be something at a time like this, pregnant women can't possibly be involved in telemedicine so much, because with a pregnant woman, every month her abdomen has to be examined and a series of things that your OBGYNs would have to do. So pregnant women are not really involved in that. It's just that as physicians, we just have to be, it can't be business as usual. You're doing temperatures when you probably weren't doing temperatures before, unless somebody said, I think I had fever at home. So just doing proper triaging before patients are seen and taking the necessary precautions during this time.
So is it, let's just be very clear with the message, is it that pregnant women should continue as usual, going to
their OBGYN? Yes, you just call your, it's a question of calling. There's a lot of calling that has to be happening. Call your physician, you will be guided, but pregnant women certainly need to be seen.
Okay, there's another question here. The health centers, what about via the health center, if an elderly person needs to renew prescription and must see the doctor before, because we know a number of them utilize the health center, but you did indicate public sector, and that means
absolutely.
The health center.
So nothing at the public sector changes. What we wrote in the press release,
and that means for the individual, the health center as well.
The health center is public sector. Is pertinent to the private sector mostly. So the health center, you go in as usual for your renewal of prescription to see your doctor, but again, things may be slightly different in that everybody may be getting temperature checks and that sort of thing, but you go into your health center as usual.
Okay, so going to the health center as usual, because
that
someone else, Marilyn Stanislas, can ask the same question there. Joby Eugene wants to know about training with individuals in the communities. I'm not sure which sort of training that Eugene was referring to. Perhaps if you want to be more specific. But there have been a number of training sessions happening across communities.
Training and education is important, and we understand that, because as an SLMDA, we have been trying to look at the gaps, because we understand at the ministry they are overwhelmed. So we have called also for the creation of a specific unit as such to deal just with COVID, because we fully support our chief medical officer, but we understand that she cannot do it alone, and we stand ready and willing to help in any way that we can. She has informed that our telecoms companies have provided telephones that will be given to volunteer physicians to help with, again, guiding patients, because everybody just needs to know what to do, so we get that sense of calm that we're looking for. We need to understand, we don't want you to panic. based on what we're seeing coming out of the countries most affected, 80% of us will be okay. It's the 20% that we need to try to protect. You hear a lot about the flattening the curve. We just need to make sure we delay this as much as possible, that at any given time we don't have so many patients that it overwhelms the system, and then we have to be making choices of who lives and who dies, that sort of thing. So all these measures, which seem very stringent right now and which seem taxing on the population, it's all in an effort to protect all of us.
Now, somebody else there wants to know, Dwayne says, how do you plan on dealing with a situation where the number of cases become overwhelming? And I think you will probably refer to if we were to begin to see in-country transmission. It's important to note that we have not reached that stage as we speak. We do not know of any in-country transmission
and that is what we are trying to prevent. So with, like I said, with all those measures being implemented, we are trying to prevent, but the social distancing, the pillars that we talk about, hygiene, cough etiquette, the social distancing, those things are extremely important in preventing in-country transmission, because we know we have 2 positive cases. They would have had contacts who are in quarantine right now. Of course, we heard this morning that some of the patients in quarantine,
those in isolation,
had come back negative results, thankfully. But we just want to, there are ways to fight this, and prevention, it still remains the old adage, prevention is better than cure. It's a virus, so as such there's no known cure. The symptoms, it will run its course. Of course, you're hearing a lot of talk of interferon that coming out of Cuba. It had existed before. It's used in hepatitis and that sort of thing, but there seems to be some success with it, as well as some of the drugs, one used for malaria. But again, everything is anecdotal at this point, that it might have worked for this person, might not have worked, but our focus here in St. Lucia, because we know we don't have the most robust healthcare system, so we need to try it as much as possible to prevent this. As far as we're concerned as an SLMDA, this is a war and everybody has to be on guard. It's a call to arms. We all have to fight this thing together.
Okay, so somebody wants to know, okay, and I guess that takes us into the collaboration of the association with the government. Is testing free?
I would think testing would be free. Of course, we haven't gotten full details of that because it's not, the training is ongoing. But testing, for the most part, testing our healthcare system, patients come into hospital, you test it, and some pay the bills and some don't anyway. But I believe testing, I would advocate for that, because the last thing you would want is for somebody to not come in for fear of not being able to pay for the test. So absolutely would advocate for free testing at a time like this.
I just have one other question coming from Soraya. Thank you. And she's saying, as a medical doctor, are you afraid of having the COVID-19 because it's a virus that is confusing the medical field?
I mean, afraid, no. Nobody wants to get it. But when you do medicine, you understand that these things will happen sometimes, that you get the flu, perhaps a patient had it, and these things happen. You have to treat TB patients, but come what may, you have to treat. You don't have the option of saying, I'm not going to treat this, and I don't want to see the COVID patients. There's a lot of voluntarism going on. We don't have physicians saying, I'm not going to do this. So we understand that perhaps some of us will get sick, but again, we just have to have strategies in place to ensure that if somebody is out, there's somebody to replace them.
Okay, and again, finally, we did hear that your association will be working along with the government pertaining to the cell phones, so
Yes.
the telemedicine that
Absolutely.
we're talking about. So cell phones would be distributed.
Yes. The cell phones would be more for as it relates to COVID. So it would be, you have symptoms of COVID, and assume the PSAs would be going out. So you could call this number and that number. We don't have the mechanic. It's similar, it would be similar to the 311 hotline. Right. So you're just calling for direction. Where do I go? We don't want people panicking and not knowing what to do and getting on a bus, that sort of thing. So we absolutely have to help in that regard, because again, it's protecting all of us. So with the telemedicine, for the private practice, it would be your own devices that you already have using for your private practice patients of sorts. And we want solutions. The panic buying is not necessary. Of course, stock up. You always stock up. Like I say, prepare like for the hurricane season. But a lot of you in the supermarket is not helping. We saw Massey. I mean, people are starting to do different things. You've seen NIC starting to talk. The telecoms company is starting to talk. Massey is living time when only the elderly would come in, early in the morning, admittedly. But at least it's a step in the right direction. But stock up on things like paracetamol. Because with this, what you're going to have, the large majority of people, fever, body aches, runny nose, that sort of thing. Ensure that you treat it, you have medication to treat it symptomatically. Because that's what the large majority of people are going to need.
Okay, I'm being shown the sign there for us to take a break. And so we'll be right back.
It's power bike time!
Oi, you need to cover your mouth. Don't you know about the coronavirus?
It's not a joke, it's a serious thing.
True that. What's coronavirus anyway?
The coronavirus is a group of viruses that causes the common cold. In more severe cases, it's like the flu.
Really? So are you saying that this is not a new virus?
No, it isn't new. It's a new strain. That's why some people say novel coronavirus. Yes, look at it like a family who just had a new baby.
I get it now. So how is it spread?
Through the air, like coughing and sneezing, touching objects, surfaces with the virus on it, touching your face, your eyes, your nose, your mouth, before washing your hands with running water and soap.
Sounds like someone has the flu or the cold. Are the symptoms the same?
The symptoms are fever, coughing, sneezing, headaches, just like the flu. In some severe cases, you also have breathing difficulties and chest pains. Some persons also get pneumonia and kidney failure, and as you have heard the news, some people have died.
Wow. So how do I protect myself?
We have always been told to wash our hands with running water and soap. In the event there is no running water and soap, you use an alcohol-based hand sanitizer of at least 70% alcohol. Try your best to avoid touching your eyes, your nose, and your mouth. And in the event you need to sneeze and cough into a tissue, you throw the tissue into a bin. If you do not have tissue and you need to sneeze or cough, you do it into your elbow.
Yes, I heard that. So what medications can we take?
Well, as the virus is new, there is no medication or vaccine that you could really take to prevent it. What we really have to do is to practice infection control measures to protect ourselves.
Hey, people. I need to get a sweat. Let's get moving.
Let's do it, guys.
So, wait, how do I get more information?
Good, I have that number on lockpile. For further information, contact the Bureau of Health Education at 468-5349, 468-5347, or 468-5342.
Let's defy limits!
Woo! Come on!
Welcome back with our last few minutes with Dr. Merle Clarke. Dr. Clarke, let's talk about a bit of the association's collaboration with the government on its fight against COVID-19. Some of the plans and decisions, policy positions that the association has taken alongside the government.
Okay, so we did write the Prime Minister on the weekend. We do think that there are some things that we need to do. Again, for us, we need to prevent this from becoming a full-blown with a large number of infections, because we see how exponentially the numbers can grow. We do think that it's to be, from an SLMD standpoint, and I thought it was reported today that the ports, it's still a bit too porous. We perhaps should be letting at this point just our nationals in, so we don't have more imported cases. The contact tracing is going on. Find those people, ensure they quarantine, get through their 14 days, and just try to limit this in as much as we can, because it's a war. We can win it, but I think we just have to have the proper strategy and get in ahead of the enemy, which is the virus. So we all have to do this together. We cannot panic. We don't want solutions to panic. We are not going to abandon you by any means. We're going to be here with you every step of the way.
Okay. And that's the president there of the St. Lucia Medical and Dental Association, Dr. Merle Clarke. Just one other question, and somebody wants to know if community volunteers to be trained to suit the needs of communities If so, how can we make it happen?
So in part that will be the chief medical, the ministry, and let me not even say more things for the CMO, but we do plan to go out, of course, in keeping with the whole social distancing mantra, but again, we think education is key and community groups use them, ensure that the message gets out to everybody. So use all sorts of media, here, social media, the radio stations, just so every single St. Lucian gets the message. We need to protect ourselves, we need to protect the vulnerable among us, and we will get through this together. We could only prevail if we do this together.
Absolutely, well said. Thank you very much there, Dr. Merle Clarke. And of course, earlier today at the top, when we began the day at 8 o'clock this morning, at 8:15, we did have on the director of NEMO, and Doreen Gustav, and she did indicate that the disaster preparedness committees, they have been activated and they have been going out into the communities, giving out the relevant information to persons within all communities across the island. And so we do have that community activation happening there. And of course, they're getting support from the Bureau of Health, which is within the Ministry of Health and Wellness. Somebody wants to know about the 311 line. The 311, as we understand it, training is now being completed for that, and the 311 hotline will be fully activated, if not by Friday, but certainly by next week. That will be up and running, where you can call and get all information pertaining to COVID-19. Okay. We will take a very short break at this time, and when we come back, we'll be doing a wrap-up.
Personal risk reduction is important. Germs are everywhere, and you can reduce your risk of infection by practicing some basic infection control measures. Taking the stairs, avoid touching the railing. If taking the elevator, ensure you use hand sanitizer immediately after exiting the elevator. Hand sanitizers with 60% or more alcohol are great to use, so have some readily available on your desk for quick use. Have your own personal bottle to carry with you when away from running water and soap. Germs can spread easily and be anywhere. Be sure to wipe down or disinfect desks, telephones, and keyboards. Washing your hands often will reduce the spread of germs, but you must wash them as recommended. Masks and gloves serve a purpose and provide protection when used in the recommended settings and when used correctly. They are not practical for the office or business place and can lead to the further spread of germs when used badly. Use only if you are coughing and/or sneezing or taking care of someone who is ill with flu-like symptoms. For more information, call the Ministry of Health and Wellness at 468-5347, 468-5349, or 468-5350.
And welcome back as we close this live hour. We'll be getting to some notices, important notices that have come at hand. We have the temporary reopening of Express Diesel, the shuttle to facilitate transfers to St. Lucia. Remember, we did have St. Lucians who were stranded in the French Isles. And this official statement coming from the Department of External Affairs. Please be advised that the Express Diesel shuttles will operate this weekend on the St. Lucia stopover as follows. Friday, 20th March, 44th, that's at 1:15 p.m. to Castries, and the arrival will be 2:45 p.m. On Sunday, March 22nd, 44th, departing 1:15 p.m. and arriving in Castries at 2:45 p.m. The Express Diesel offices will reopen on Friday, March 20th at 8:30 a.m. The St. Lucia Consulate in Martinique advises that all persons who require to modify or buy tickets present themselves at a ticket booth very early in an effort to alleviate last-minute disruptions. Kindly note that tickets can also be purchased on the Express Diesel website or the call center. Be advised that in keeping with the protocol guidelines established for COVID-19, all passengers upon arrival in St. Lucia will be quarantined. Again, in keeping with COVID-19 protocols, all passengers arriving in St. Lucia will be quarantined. They'll be isolated or asked to self-quarantine depending on the symptoms exhibited by each passenger. There is a travel restriction to St. Lucia on persons with a travel history within the last 14 days to Hong Kong, the Republic of Korea, Japan, Italy, Singapore, Spain, France, Germany, Iran, and the United Kingdom. Persons who traveled from the United States and Canada within the last 14 days to St. Lucia and who develop respiratory signs and symptoms will be isolated and tested for COVID-19. The St. Lucia Consulate in Martinique wishes all returning nationals a safe trip back home. Please quarantine and stay safe. We have another notice coming from the Department of External Affairs, this time having to do with the United States Embassy. The Department of External Affairs is in receipt of communication from the Embassy of the United States of America in Bridgetown, Barbados, informing of its decision to limit visa processing to cases not requiring personal appearance, such as government and diplomatic visas, and categories already entitled to interview waiver. This decision was taken in light of the evolving worldwide pandemic and in order to minimize exposure of staff and patrons, and takes effect from Wednesday, March 18, 2020. The decision will affect both immigration and non-immigrant visa processing, and the renewal interview waiver and interview waiver program remains optional. You can get more information on the U.S. Embassy's website. And the Embassy has advised that the consular section will consider emergency requests on a case-by-case basis. St. Lucians who have already secured appointments and have paid the machine-readable visa, and you've paid those fees, you are informed that payment remains valid and may be used in the country which it was purchased within 1 year of the date of the payment. The Embassy at this point is unable to provide a specific date when appointments will resume, but has assured that the department that it will notify as soon as a date is set. And when a date is set, St. Lucians are advised to visit the website to reschedule appointments at their convenience. Very important notice coming in from WASCO. The Water and Sewage Company Inc. WASCO is informing the public that due to the onset of COVID-19, the previously announced planned shutdown of the water supply to the north of the island for routine line maintenance on the 25th of March 2020 has been postponed until further notice. This is because the company is fully cognizant that one of the most powerful and effective ways at reducing the spread of the virus is to frequently wash hands with soap and water. Therefore, we will continue to closely monitor the raw water line and will advise the public adequately in case of any emergency. However, WASCO is advising consumers, the general public, that because we are entering the dry season, all measures should be employed to conserve water and to avoid wasting the precious resource. WASCO further advises that wherever and whenever possible, consumers should ensure that they have a stored supply of water and report all leaks promptly to WASCO. In addition, WASCO has increased its surveillance as a means of protecting its staff and its valued customers due to the onset of the virus, and with immediate effect, the following measures have been implemented. All consumers are encouraged to utilize the electronic banking services and other authorized methods of bill payment to expedite the settlement of the same. In addition, as a means of practicing social distancing, no more than 5 persons at a time will be allowed into the customer service department at any of the offices, and of course, hand sanitizer dispensers have been placed at the customer service departments. Messages there coming in. We now go across to Primus, who will be able to inform our Creole viewers and listeners.
Ok, merci Lisa. Quand Lisa dit, merci madame, nous nous d'autres ou apport que nous recevons à différentes agences. Nous avons regardé situation Wasco, quand Lisa en élite là d'aller Wasco, ça c'est compagnie de l'eau cette ici, qui voulait informer le public là qui parce que en situation en considération situation COVID-19, ça c'est situation maladie corona, puis il a été annoncé avant qu'il y ait fermé service de l'eau pour face à notre pays pour te faire travailler sur Tiro, ça était pour le 25 mars. Il a envoyé ça pour le présent. Ça c'est parce que compagnie Wasco qui comprend l'importance et raison nécessaire pour réduire sérieusement à son maladie et ça qui est nécessaire pour faire c'est pour mon servir de l'eau à pile pour laver la main de toute façon. Alors il faut continuer pour regarder la situation de l'eau et qu'il faut conseiller public là en cas de secours. Mais en même temps il voulait conseiller mon pratique là public là généralement qui quand nous quand dans saison carême et qu'il y a pour tout ça qui est nécessaire pour conserver de l'eau, pour pas gaspiller de l'eau, parce que aussi qu'à conseiller qui n'importe qui possible pour les pratiques faire assurer yo mettre un pile de l'eau servir pour conserver de l'eau, alors servir drum, servir n'importe manière ça pour ça chaîne de l'eau et pour empêcher la pièce tuyau qui coule ligne akayo kini citerne kakule pour essayer pour contrôler ça. Par ça, parce qu'on continue à garder manière pour protéger le travail et toutes ces pratiques là pour maladie ça là et immédiatement il y a établi ces façons ça là. Il y a dit toute pratique il y a encouragé pour servir système service banque des affaires électroniques. Alors, on a fait paiement par banque là des services des affaires électroniques, comme ça, pour payer bilo. À part de ça, en façon pour chaîne mon loin à l'autre, quand il y a des social distancing, il y a un qui était sec seulement pour entrer un département pour bail service, département qui a un autre département côté ces pratiques là qui venir pour payer bill là payer bill loyo yo kay ani quitter sec mon entrer chaque sec mon il pas quitter la combler et puis mon yo ka demander pour aussi servir médias social pour faire communication et puis Quasco yo aussi ka demander pour servir hand sanitizer ou ça avec yo ka ça un département pour toutes les pratiques yo servi au rapport qui a sorti du ministère des Affaires étrangères à ses affaires visa, département qui a fait, vous savez, qui a trouvé communication avec l'embassy à l'Amérique à Barbade, qui a informé qu'il y aura une décision pour limiter à ce quantité de visa qu'il y a bail. Ça c'est visa monde qui a gardé pour visa pour voyager. Il y a mettre attention plus à ce affaire gouvernement. Ça c'est visa pour gouvernement diplomatique visa avec l'autre affaire comme ça. Alors ça il y a dit c'est monde qui veut visa il y a limiter ça il y a faire plus attention pour affaire officielle comme gouvernement avec l'autre affaire comme ça. Tout ça qu'a fait au résultat de situation maladie corona pour réduire à sous maladie sanctuaire l'autre monde avec comme ça. De travail avec l'autre affaire comme ça. Je dis ça a venu ça a commencé le 18 mars. Yo di décision qui affecté moun qui ka émigré et non moun les autres moun qui veulent voyager dans l'autre pays aussi. Yo ni aussi un programme pour réviser programme là ça dit ça va rester ça va continuer à opérer. Yo ka aussi conseiller section consulaire, ça c'est consular section pour considérer pièces secours qui est nécessaire en cas ça là. Sous ou besoin pièce assistance à part de ça ou quand pour faire contact et puis embassy à Barbade. C'est cette série que j'ai fait appartement et qui a payé pour visa yo ka informé que ça va rester valide et pour presque l'année en date là qui yo fait paiement ça là. Et ça c'est information qui a sorti hod embassy Barbade. L'autre information c'est Express Diesel, ça c'est bateau qui a voyagé Martinique cette ici. Yo ka informé qui yo ka opérer en finissement semaine ça là et yo ka commencer vendredi 20 mars en mois de mars. Fort de France, yo ka quitter Fort de France à 15 minutes après yon pour arriver Castries à Yoka pour 3h après-midi. Et dimanche le 22 mars yo ka Express Diesel qui a quitté Fort de France à 15 minutes après yon pour arriver Castries à Anka pour 3h. Bureau Express Diesel qui est ouvert vendredi le 20 mars à 8h30 bon matin. Consulate cette Lucia à Martinique qui a conseillé tout le monde qui voulait acheter ticket pour faire assurer yo présenter koyo en place là koyo ka vendre ticket il faut pour faire ça bien vite pour ça par les pièces d'encaissement yo ka noter qui ou ça aussi acheter ticket à son website Express Diesel. Pour suivre règles qui est établi pour COVID-19, tous les passagers qui arrivent à cette liste sortir à Martinique qui quarantaine, ils ont survection, ils ont isolé, ils ont demandé pour isoler quoi. De par ce système là, man malade là, si on est signe de maladie ça là. La restriction à ce monde qui a voyagé cette liste, l'autre 14 jours, monde qui a sorti Hong Kong, Republic of Korea, Japan, Italy, Singapore, Espagne, France, l'Allemagne, Iran et l'Angleterre. Moun qui a sorti de l'Amérique et Canada en l'autre 14 jours pour cette ici qui m'a personne yo ka isolé et garder si on COVID-19 et que yo ka consulate là qui cette ici c'est consulate cette ici à Martinique veut informer toute nation cette ici pour ça un bon voyage via cette ici et quand vous vient qu'on nous dit vous pouvez mettre en quarantaine et comme dit que vous restez de bonne façon.
Thank you so much there, Primus. It's important to have our Creole population in on the information. And just in case, for those of you who had joined us earlier today and then you've seen that we have some of a different backgrounds, that's because we are preparing for the National Day of Prayer. That's happening tomorrow. And tomorrow morning we'll be having Pastor Ben. He'll be there to kick things off very early with us in our morning segment at 8:15. We want to also say thank you to the local stations that joined us today, DBS Television, MBC, and GVD. Thank you so much for being with us throughout the day. Also, for persons who would have perhaps missed all of this information that happened throughout the day, we implore you to go ahead and on our Facebook page, you have the YouTube channel. We also have for some of the notices there, you can go on to the Government of St. Lucia website where you will get the notices posted. And of course, NTN, this entire thing is back in replay, so you can get the information there. Just wanted to say to one of our viewers who wanted to know whether we are practicing what we preach by the social distancing. Yes, I know on television it may not seem that way, but yes, we are in fact very far apart. but on television it seems to look a little closer. And for the one more note on the National Day of Prayer, Pastor Ben, as I said, will be here to kick off in the morning, but the actual praise, worship, and fellowship will be happening 6 p.m. to 8 p.m. So right here, NTN, it will be live, and of course the other television stations will be tapping into our broadcast. All that's left right now is for me to say thank you so much for spending the day with us. We will return tomorrow morning, God willing, to do it all over again. I'm Lisa Joseph on behalf of Primus Hutchinson and the entire production team here at NTN GIS. I'm Lisa Joseph. See you next time.
Personal risk reduction is important. Germs are everywhere, and you can reduce your risk of infection